Hello everyone, welcome back to the channel. I'm the Pineal Cyst chick, and today I am sharing with you what I believe to be one of the most important videos that I will be recording. This video is my pineal cyst diagnosis story and everything that led up to my surgery. The reason I feel that this is such an important video is because I believe that some of the mistakes that I made along the way are going to be helpful to somebody else that is trying to make their way through this journey. And I'm hoping that they can learn something from the mistakes that I've made that will helpfully make their journey a little bit easier in finding and getting treatment. So, one of the most important things I think that we need to all understand right out the gate is that oftentimes you hear the word cyst and you believe that that correlates with harmless, that this is something that has no impact or no bad effects. And that's really a big problem for a few reasons. One, medically, it's hard for professionals to take it seriously. And also, it takes an emotional toll on the person who has this condition. And when someone says to you, it's just a cyst, and I've heard that from my well meaning people in my life as well as medical professionals, but a cyst is not always harmless, and a tumor is not always harmful. And I think that's one of the real problems, at the root of one of this problem. A pineal cyst is a cyst that grows on the pineal gland. The pineal gland normally is about 5 millimeters. It's located smack in the center of your brain, and it's believed that it has a function in the production of melatonin, which correlates with your sleep and wake cycle, your circadian rhythm. So the reason why I say that it's important for us to understand that this cyst is not necessarily a harmless thing is because the presence of anything in your brain has the potential to be a problem. And I think that we kind of lose sight of that when we call it just a cyst. And to be clear, it's not a sure thing that it is indeed a cyst. Until it's out and the contents are sent off to pathology, it's not even clear for sure that it is just a cyst. In the meantime, the presence of it in your head is possibly placing pressure on important structures that are related to your vision. It can obstruct the flow of cerebral spinal fluid inside your brain, and that can lead to a lot of the symptoms that we're going to talk about. So I'll also mention that I am not a doctor. This is not medical advice. I'm not in any position to do that, although I have been a physical therapist assistant for 15 years. And so I'm comfortable with medical jargon and understanding medical terminology. However, this is not intended to be any type of medical advice. This is just me explaining what my journey was involved, and hopefully it may give you some clues to help you navigate your own story. So in 2019, I was on my way to work to see a patient. I was driving, and I had a piece of candy in my mouth, and I suddenly felt like, what is that? It was weird. I had this funny sensation, and I realized that the left side of my tongue, cheek, and face was going numb. It was tingling, numbing, and I instantly thought that I was having a stroke. I called my husband. I pulled over. We called paramedics. They came. They told me that I was not having a stroke. In fact, they said that I was having some sort of a panic attack. I had no history of panic attacks or anxiety or depression at that time. So I did not get transported by the paramedics. However, my husband took me to the hospital. When we went to the hospital, I had an MRI. They did a CT scan, and that was when the pineal cyst was discovered. However, uh, they indicated that it was an incidental finding and it was not the cause of the symptoms that brought me to the emergency room on that day. Um, Rather, they said I had some form of a migraine, possibly, or some type of, I guess, anxiety, panic related situation, which looking back, that doesn't make any sense at all. But the migraine part of it was believable, and so the symptoms subsided. I went home and I had one follow up visit with the neurologist where they um, told me that, yep, it looks like you have some type of a migraine condition and all is well and good. Being the medical professional that I was at the time, I did read the report. I specifically asked about the cyst that was written about in the report. The neurologist assured me that this was an incidental finding. Many people have these, and that they only know that they have them after they've been checking their head for something else, such as they've been in a car accident or they have some other neurological condition that they're looking for, taking scans of the brain. Otherwise, people don't even know that they have them. So I went on without any more headaches, no more migraine, although I did have a really bad headache that day after that occurred. When I started to notice that I was having some problems, like with my memory and my concentration. And about 5 months after that incident occurred, I was diagnosed with ADHD. My son was diagnosed with ADHD, and as I was going through the diagnosis process for him, I realized that many of the symptoms he had, I was having problems with as well. Problems with my concentration, hard time focusing on like paperwork, things related to my job, the paperwork part of my job. I was getting very absent-minded, having problems losing things all the time. Prior to all this, I was really a very organized person. I was known for being a very organized person by my peers. And so this was a big change for me. And I thought, wow, like, what is happening? I'm going through these weird changes that, like, I don't feel like my head is screwed on straight. You don't know how many times I said I felt like I just didn't have my head together. But I did go do over 2 hours worth of testing that revealed that I had symptoms consistent with ADHD. I don't doubt that I do have ADHD because a lot of my personality is consistent with a lot of symptoms related to ADHD, a lot of the good ones that I have. So that doesn't concern me much, but I had navigated my life very well. 2 different college degrees, and never really, this was not an issue for me. So although surprising, I thought this was the answer to why my head was not screwed on straight. Over the course of the next couple of years, I had a couple other diagnoses, such as anxiety and depression. I started having considerable problems with getting sleep. I had a problem getting to sleep, staying asleep, and I attributed many of these problems to just having a busy, stressful life like many of us have. The real crux that eventually led to my diagnosis was the vision difficulties that I started to have. I guess it was maybe 6 months or so after the ADHD diagnosis. I had an eye exam. I said, my vision, I'm having trouble focusing. Seems like things up close. I have to shut one eye to kind of see it well. Just depth perception problems. My eye doctor at the time told me that I was getting older and that potentially I was having problems with my reading vision. And that was the first time that I got a pair of progressive lenses glasses. Well, I did not do well with those, and although you only get an eye exam once a year with your insurance, so even though I wasn't satisfied with my vision, I dealt with it. And then the next year, I said, listen, I don't know what it is with these progressives. I tried the contacts, I tried my progressive glasses. This is actually them here. They're just a regular pair of progressive lenses. And I said, I don't know what it is. I need single vision. This is not working for me. My eye doctor said, calm down, let's just check your eyes again. They may have changed. And I didn't really know at the time that it was unusual for this to be the case, but my left eye was almost two whole diopters worse than my right eye. They're very different, and that apparently is uncommon. So, but at the time, I thought, well, I guess that's just my bad eye. And so she changed my prescription, got my new glasses, anticipated that everything would be great, and lo and behold, they did not work well for me. I still was having problems with focusing, and the need to shut one eye was increasing. And there were times where I felt like one eye was starting to cross. I had no history of this either. So I'd had 2 eye exams and 2 changes in my prescription that was not working for me. And then I guess about last December, January, I went and I had an eye exam. And no, that was the second one. And it wasn't even until March where I said, I can't take this anymore. I got to do something. Because by then, I was starting to have symptoms of full-blown double vision. I went to a new eye doctor because I didn't feel that the eye doctor I had was really grasping the degree of concern that I had. As I stated that I was experiencing one eye kind of trying to cross, and she responded, well, that shouldn't be happening. And it was as though when she updated my prescription, she believed that that was going to solve my issue. I tried getting contacts that were just single vision because I'd been a contact lens wearer for over 10, 15 years, probably 15 to 20 years. And so I just didn't understand what was going on. Why can I not get my prescription right? I went to a new eye doctor. Actually, I had seen her once before. And after an eye exam, she said, I believe that you have something neurological going on. She asked me if I'd been in a car accident. Did I have cross-eyed strabismus when I was a kid? Did I ever hit my head on anything? Did I have, any history of head trauma, which I did not. So she said, you're going to need to get an MRI. You need to contact your PCP. You guys need to figure out what's going on. So I went back to my PCP. I got orders for another MRI, for an updated MRI. I had forgotten that in 2019 I had one in the first place. And so after that happened, I went home and I thought to myself, gosh, I don't know what's going on with my eyes, but I get new pictures of my brain, and then I remembered, oh my gosh, I have old pictures of my brain from 2019. So I dug up the report, and lo and behold, it states in the report, and this is the most important thing for the big mistake that I missed. It said that I did have this pineal cyst. It was 1.7 centimeters in size, and that it was causing distortion and flattening of the tectum, or the tectal plate inside my brain. That's right. It already was screwing up my brain in 2019. And so that's what happened. We got another MRI, and at the largest point, the cyst was 2.2 centimeters in size. So it had increased in size. And the onset of the litany of symptoms that I had all started from that date. So to keep this video from being excessively long, I wanted to explain to you how so many red flags were missed by myself, by my primary care physician, by my eye doctor, and that moving forward, it's something that's important to me, is increasing awareness of this condition. And there are many like radiologists that look at these reports and doctors that interpret these reports that do not include this in the findings at all. Now, my last MRI cost over $3,000, like closer to $3,500. And I personally find it shocking that you can spend that much money on a test and you don't even get the full test report. So that is a major problem. I have a goal to be able to contribute to this cause by helping make other people aware of these conditions, and making it possible for us to get treatment or help. This is by no means indicating that everybody who has a headache or any of the other difficulties that I had over the last couple of years has this problem, nor necessarily do they need surgery to treat it. That's not what this is about. But patients need to know what is in their brain, and they have a right and a necessity to ask questions and to fully understand. Because had I known this a year into my eye difficulties, I would have been probing into if this was a problem for me, which ultimately it was. And now I have double vision, and we are prayerful that it will be resolved, that I have now had surgery less than 2 weeks ago, which I'm super excited about. I'm doing great, and I'm looking forward to getting better, and I'm looking forward to helping other people be able to get better. So I will be going a little bit more in depth on my surgery, what was involved, how they did it, what they did, where they did it, my surgeon, and all of that good stuff in another video. But today I just wanted to tell you about the process of finding out that I had it, forgetting I had it because it was told to me to pay it no mind, that it was incidental, and in fact it created all kinds of problems in my life. So I thank you for watching, and I hope you'll stick around to check out a few more of my videos as we continue to bring awareness to this issue and move together towards educating both patients and medical professionals about this so that patients can get the care and the treatment that they need. Thanks for tuning in, and I will see you in the next one. If this is something you're interested in, please subscribe and share it with a friend if you want. Thanks. Bye.